Hello, greetings everyone. Again, it's a pleasure to be with all of you today here, whatever the time zone you're watching this interview. Another interview in the Data First AI Later newsletter series. As you know, every bi-weekly edition, we have with us here some renowned guest speaker from the industry leaders, activists, and today I have the pleasure to have with me Este Geraghty. Este is a medical doctor and chief medical officer and health solutions director at Esri. Este, thank you for joining us.
It's a pleasure to be with you, Paul. Yeah, that's a long title, but it is true. I came to Esri 11 and a half years ago after having a decade-long career in academic medicine. I'm an internist by training, and I also spent a few years as a deputy director at the California Department of Public Health. So it's been great to come to Esri with this sort of broad experience where I can bring it all together on the technology front. So my role at Esri as Chief Medical Officer and Health Solutions Director is very much nowadays thought leadership, executive engagement, and really strategizing about the most impactful ways that we can use geospatial intelligence to improve health.
Wow, well, that's amazing. I'm sure you're not never get bored. Uh, but talking about geographical information systems (GIS) in health and the data first principles, I wonder, is this a vision you would subscribe to, having data first before developing AI applications?
Yes, in fact, I've said similar things before, and being maybe in some way even more detailed. Without good, timely, current, accurate data, um, AI is just making assumptions on bad information. And more important than that, often is, or equally important, I should say, is the metadata. Because to properly train an AI, you really need that metadata about the data to ensure that there are understandings about the limitations of the data, the intent of the data, and how it was collected and what the available fields are. So I agree wholeheartedly. You must have good, accurate data first before you push into AI.
It's interesting and amazing, and thank you for this, because obviously I see that when we're talking about geodata, there's nothing more tangible than geodata, right, Este? So what is it that you bring to the equation when we're talking about innovating in healthcare and innovation research? How geodata can have an impact in healthcare innovation?
Well, I know we don't have 10 hours for this conversation, but I could go on for quite a long time. What I'll say is that I am intrigued by the idea that right there in almost all of our data sets is a geographic component.
Mhm.
And people are not always using it to its fullest extent, yet it can be completely transformational in healthcare. So I think about it in a number of ways, but I think some of the easiest ways to understand are that when you understand geography or the context of a thing that you're interested in, you can understand things like a person's access to care or community amenities, how likely they are to be vulnerable to different health conditions or resilient in the face of disasters. You can actually tell quite a lot from just a single person's address. When you put that together at a population level, you can guide decisions about how resources are allocated based on need or the conditions at hand, like the spread of flu, for example. You can make sure that those resources and people are where they need to be in order to respond. So you can see patterns of things like, do you have a cancer cluster that needs to be looked at in a different way? So geography just like boom, it's a light bulb, right? It goes on. When you can see it and you can measure it, you can start to intervene. And in some cases, you can't unsee things like disparities in health that you then need to address.
Absolutely. It's amazing what you're sharing. And tell me something, Esther, because I'm curious about how can GIS support bias detection and correction in health data sets for AI?
Sure. Well, there are so many different ways that it can, but I often think of the social determinants of health. And I think everybody in health really understands this framework, looking at all of the various contextual factors between education access and quality, healthcare access and quality, your economic stability, social context, and neighborhood and built environment. Those factors, and they have a lot of data variables associated with them as well, really tell us a lot about what is impacting our ability to achieve our highest health. So when you put those things on a map and you lay it against health outcomes, it becomes very visible to you and clear where disparities are, and you can also do analysis to figure out what are the root causes of those disparities. So the first thing I would say GIS does is it promotes understanding of the problem and the analysis of the root causes. Then you can start to use GIS to prioritize different kinds of interventions, because in one place, it might be that you need to improve healthcare access. In another place, it might be that you need to provide educational materials in Spanish. There are so many different ways that you can look at this and then apply it to do a better job at risk communication or intervention prioritization.
It's interesting because when we're talking about, and now this is the seek to go into the real world evidence and case studies, it's interesting because for policymakers, if I was a policymaker in the field of health, I would absolutely require dashboards to be in my room all the time. Geographic dashboards, and this is obvious to some researchers, but not so much to policymakers. What is it that geographic information systems can add on top of real world application studies?
Yeah, so I can give you a great example, policy oriented for a map based dashboard. One of my favorite examples comes from a colleague of mine who was working to get a bill passed through the US Congress about making medications available to a group of people with amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's disease. So this is a disease that is pretty much universally fatal. And so people are more willing to get experimental drugs earlier than through the entire review process by our Food and Drug Administration. So my colleague, who has this disease, built a map-based dashboard to show all of the legislators that have already voted for or were against this Act for ALS bill. And what he did was really intelligent, because it was not only a dashboard to show progress of that bill and calling, representative offices, but it had in there text that people could use to tweet or Facebook to their congressperson. It had, he put in all of those congresspeople who had filmed the ice bucket challenge for ALS, if you remember that years ago. So saying things like, well, you supported ALS then, would you support us now, please? And honestly, this was so powerful to have it visible. Everybody could access information and contact their representatives very quickly because it was all in the dashboard. And you may never seen this before in the US, but it got a 100% positive vote.
That's amazing. That's amazing, Esther, because listening to you, it's not just the dashboard for the policymaker, it's a dashboard that is to be shared to the community so we have more transparency in the decisions we make in healthcare. That's amazing. And definitely, I was wondering if you could bring up some more examples. So try to convince policymakers on having a mandatory GIS approach to health data. What are other examples you could share on dashboard impacts in better decisions and better health outcomes?
Sure. Well, let's go with the most famous one in the world. How about the Johns Hopkins University COVID-19 dashboard?
Mm.
Um, that was really intended in the very beginning to be informational and show what was going on with this brand new virus and how it was spreading. And it really took the world by storm. It is literally the most viral map-based dashboard in the history of the world, right? It was viewed trillions of times over its 3-year history. And that dashboard, first of all, they used open data behind the dashboard, which was a stroke of brilliance because then everybody could take the data for their location, combine it with their own data, and then create a dashboard that was meaningful for their policies and interventions and what they wanted to do. So that dashboard and the data behind it was used for things like where to put testing materials first, and then also later for balancing when should we reopen our communities after the lockdowns, right, and the isolation that people had. So it was used for a number of different policy decisions, also including the data was pulled into a number of ensemble models that organizations used to determine when they had to increase hospital capacity in their area. So you would call that surge capacity, right? When hospitals would be overextended based on the number of cases that they could see coming their way. So I would say it had a lot of policy impact.
That's amazing, Esther. You know, in my current country of residence here in Portugal, one of the big news items on the television and all over the media is the fact that our emergency hospitals for lack obstetricians.
Mm.
So we have this crisis where women that are pregnant can face the fact that their normal hospital is closed and they have to go to another hospital. So this is a scenario where I imagine GIS could have a really powerful impact because, and I raise this question also ethically for you to consider, because could we also map where the obstetricians are physically located at the point in time so we can plan these resources allocation in terms of
Well,
manpower?
yeah, absolutely. I don't think there's any ethical problem with mapping physician locations, assuming they're not using their home residence as their practice location. But otherwise, that's perfectly reasonable to do. And in fact, we often show a demo of this very situation. But it's not only their locations. What GIS allows you to do is add a service area around those clinical locations. So you have to consider what is access to an OB-GYN physician. Is it a 30-minute drive? Is it a 15-minute walk? So you have to decide for your context for the country of Portugal, what does that mean? Let's just say it's a 30-minute drive time. Once you do that, then you could see all of the places that have a gap. But then you have to look at additional data, right? The places that have a gap could be low population or maybe not have poor health outcomes at all. So you want to put your outcome information and your population information in there. Then you have to think about what are the possible interventions. I mean, the obvious one that people would think of is, oh, we need to hire or train more OB-GYNs, but that may not be a very immediate decision. But could you find communities that would benefit from installing a telemedicine location that then has access to a place where there are specialists that can at least provide the diagnosis and treatment recommendations, and then maybe occasionally visit or route mobile care units that can go out a couple days a week and provide that needed care to the places that need it most.
Absolutely. I think the Portuguese authorities have to listen to this interview because there's lots of insights that we could think about if a proper dashboard in terms of geodata for obstetricians and even where are the pregnant patients located. I think this could also bring lots of information that could help policymakers to have a better response to this crisis. But I'm sure other examples must come to your mind in other countries where you operate. Este, I know that you're a globetrotter. You know lots part of the world. Is there any other cases where these kind of dashboards can help better decisions and better health outcomes in the end?
Yeah, let me mention one that won an award this year from Esri, because we saw that they were really doing some great work, and we call this the SAG Award, the Special Achievement in GIS, and that went to the Ministry of Health in Malaysia. And they're doing many things with GIS. They're tracking infectious diseases like filariasis. But the one that has me really impressed is their dashboard that looks into the future. It is a predictive analysis dashboard for the future of healthcare in Malaysia, looking at expected population growth in different areas, where they may need new clinics or hospital locations, what kind of equipment and healthcare capacity, so healthcare professionals will be needed. So 50 years out into the future, they're starting to look at what these needs are so that they can grow their health system according to what is expected. Obviously, with a dashboard and shifts, they'll be able to be a little bit more agile because the data is all right there for them.
Absolutely. And also to involve the public, because then the public could see the reason for decisions to be made, right? Because everybody has the map of the situation before their eyes. That's great. That's great, Este. Thanks for sharing this. So we're approaching the final part of this interview here. I would like to address collaboration opportunities. Where do you see that GIS methodologies as self-assessment tools for organizational data readiness, right? So that's another issue that we'd like to bring to this conversation.
Yeah, I think there's the innate opportunity to collaborate with GIS, and we try to build a platform that makes that easier for people, because we know it's very difficult, not only within an organization sometimes, but across organizations. And my view is that healthcare challenges have become more and more complex in our world today. And so for just one party, like the public health or the Ministry of Health department to handle it, it's not going to be enough. You need others to support. So here's one example, and it has your favorite tool in it, dashboards, and that is with Tempe, Arizona. So this is a city in the US state of Arizona, and they have been working hard to address homelessness in their city. And so they built a series of dashboards that are really meant to be collaborative. So those dashboards can be accessed by and the data updated by their law enforcement agency and their public works agency, as well as public health. So one example of a dashboard is with encampment hygiene. So the public health department may be putting out hand washing stations where there are encampments to help people stay safer, and the public works department is marking when an encampment has been cleaned up in that area. So they're working together to try and prevent things like something that happened in San Diego, I think in 2017, an outbreak of hepatitis A in the homeless and injection drug user community, with that kind of overlap that they often have there. So they're doing a really good job of creating dashboards everybody can collaborate on. But honestly, you can do so much more than that with the platform. Agencies can all have access to the same data. Like you can look at the US Department of Health and Human Services, really trying to centralize data so that everybody can have access. It's the same as happening with California. They have 13 health and human services departments that all need access to the same kind of data. And so now with their GIS, they're all able to use that authoritative data so that it's not drawing it out from your warehouse and then using a copy of it to do an analysis. It's using the authoritative data. And that makes everything a bit more trustworthy and reliable. So yeah, lots of ways to collaborate, but Tempe is my top favorite right now.
I bet that. And we are preparing now a self-assessment tool. So I'm wondering if we could cross the self-assessment with a world map where we see the different levels of readiness in terms of organizational health data readiness, right? So
Absolutely.
that's a great project that we can talk about. And obviously, I would like to invite you to, if you're in Italy, to take a plane if you can and join us next week in Cardiff. And still, we are not addressing GIS in the summit agenda this year, but definitely. But if you show up there and if you talk, maybe we can start preparing the next edition that will be in Spain, 2026, with the much more in-depth approach on geodata, because I'm a big fan. It's a really important piece of information that, as you say, most often is overlooked, and it's ubiquitous. And sometimes it's just a question of having the right tools, the right platforms to make the most of it. So here's my invite to you to join us in Cardiff, the next edition of the Health Data Forum Global Hybrid Summit. And wrapping up the conversation, Este, I think that it was a great talk to you. I learned a lot today, lots of new ideas, lots of insights. What would be your recommendations for 2025, 2026 in terms of health data and geographic information systems? What will be the recommendations you'd like to share to the community?
Yes, I would say if you're not already looking at the geographic component of your data, please start. If you are worried about, you don't know how to use this technology, which is one of the most common worries, don't worry anymore. I have a free Health GIS curriculum. It's about 40 hours of tutorials and blogs and videos to help you get comfortable using the tools that are most important for our sector of health. So you can sort of minimize that training time. And if your other worry is about using location data and privacy, don't worry. In that curriculum, there are lessons to teach you how to use geographic data safely and ethically according to all of your local laws and governance policies. So you can do it. It's not too hard, and you will be amazed at the transformative potential that it has in your organization.
Oh, that's awesome, Este. Thanks for the offer. And dear viewers, we are going to post that on our Data First AI Later website. In fact, I'm thinking out, Este, if you agree, let's create a page on geographic information systems and direct people directly to your training, because if it's free, I think it's worth to mention that, obviously. Dear viewers, thank you so much for watching us today. It was really great and a pleasure to have here Este with me. I hope that you've also benefited and learned from this conversation as much as I do. Este, thank you so much for your time here with us.
Pleasure.
And looking forward to see you in the next episode. Stay tuned, stay safe, stay healthy. Goodbye.
Bye, everyone.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare, better diagnoses and treatments, making healthcare smarter, one innovation at a time.